Friends, welcome to my workplace for hands-on Phaco and SICS training. Let us observe this totally unedited surgery and let us see vertical chop in this case. This is the main incision with a 2.8 millimeter steel keratome. The incision has been placed at mid-limbus. This is a bit of adrenaline to keep the people dilated during surgery. The antechamber is then filled up with 2% hydroxypropyl methyl cellulose, and methyl cellulose is applied over the cornea for better visibility. This is a side port on the left side of the main incision about 3 clock hours away. And now capsulorhexis is being done with the help of Utrata forceps. And this is stereocoaxial illumination of Lumera T microscope. Beautiful red glow. Rhexis is done, and now hydrodissection is done with the help of BSS. The nucleus is stabbed and the nucleus is rotated. Again, the anterior chamber is filled up with visco. And now is the time to introduce the phaco needle, and before that I am just enlarging the main wound by on-cut, and this will help in easy entry of the phaco needle, and it will allow leakage around the phaco needle and the wound will remain cool. Some superficial cortical lens matter is removed. The handpiece is then turned, the tip is buried firmly into the anterior chamber, and see the vertical chop. The chopper is placed just in front of the phaco needle, goes deep into the substance, lateral separation is done, and the nucleus is chopped. So I am getting lot of pieces, maybe about 7-8 pieces before I start emulsification. And now I start emulsifying the nuclear pieces. Ultrasonic energy is set at 75%. Flow rate is 48 ml per minute. Vacuum is 480 millimeter of mercury. If we keep the vacuum at higher setting, you can still control the vacuum because of the SPEEP mode of the machine. And now see the contact lens concept. As I emulsify the last piece, the epinuclear shell around it is detached and it is kept like this, and it protects the PC till we emulsify the last piece. Ultimately, we remove the nuclear shell also. And now there is a lot of cortex remaining. Inject some visco. Then I take the 23G Simcoe cannula. It goes and I start removing the cortex. I use a 10 cc glass syringe. Plastic syringes are painful to the hand, so I use 10 cc glass syringe for using a Simcoe cannula. The side port is very small, so I don't go through the side port. First I have to enlarge the side port a little bit. Don't forcefully go through a small wound. If you go forcefully through a small wound, what happens is it becomes a round like a fish mouth because of the stress, and it doesn't want to close. So if we enlarge the main wound just by one cut, it heals it heals very fast, and the closure of the wound is very quick. We don't have to hydrate a lot to close this kind of wound. What I mean is the side port should be adequate. It should not be small. And this is implantation of hydrophobic acrylic single piece monofocal intraocular lens under Visco. Once we place a lens under Visco, we have to remove the Visco thoroughly. First, I am using the Simcoe cannula. I go behind the IOL and irrigate and aspirate the capsular bag. So after removing a significant portion of Visco by the Simcoe cannula, I take the bimanual irrigation aspiration. You can avoid using Simcoe, that is your choice. You have to use a lot of quality time to remove the Visco by anything, either bimanual IA or coaxial IA. And now I am going through the main wound by the irrigation, irrigate and aspirate the anterior chamber. Place the irrigation behind the lens and aspirate from in front, and I find that the Visco is nicely cleaned. And the antechamber is not shallow because the side port is adequate now. It is not stressed. Leakage was not much. And now I hydrate corneal stroma and close the side port. Little bit of hydration is required. This much is enough. And the main wound will not require any hydration. Doing this final lavage with Simcoe, come at the main wound, keep it there for a second and form the anterior chamber. The patient was under topical anesthesia, and we conclude the case here. Thank you very much for your attention. Hope this video will help you in developing your surgical skills. Be a great surgeon and serve your patients with love, respect, compassion, and great surgical competence.